Period. Most people, well, when they start talking about puberty in class, start giggling or are kind of uncomfortable talking about it. But once you do get it, you want to use tampons. Here's a thing to look out for, but not to be too scared about. It's TSS, Toxic Shocking Syndrome. It is a very, very rare illness, so don't be afraid to use tampons still. It can harm organs like lungs, liver, and kidney. It can be a deadly disease. So some of the syndromes can get worse very quickly, but I'll tell you the symptoms. So sudden symptoms are sudden fever of 102 or over 102 Fahrenheit, including there's also low blood pressure and rapid heartbeat, nausea or vomiting, fainting or feel lightheaded, restless or confused. There's also a rash that looks like a sunburn. I know these are a lot of symptoms, but listen. There's a rash that looks like a sunburn. The rash can be over several areas of your body or just in center places, such as armpits or a groin down there. Or there can be severe pain in infected wound or injury. Other symptoms are severe flu-like symptoms such as muscle aches and pains, stomach cramps, or a headache or sore throat. Redness inside the mouth or nose, pink eye, scaling, peeling skin, especially on the palms of the hands or the soles of your feet, which is the arch in your feet. Now, if you do have those symptoms and you use a tampon, I think you should tell your parents, or if you're uncomfortable with your dad knowing, you should tell your mom or an adult and get it checked out by the doctor, because if it is TSS, it can be spread quickly, and it also can be deadly, like I said, and it can be deadly within 2 days. So you might, if you do have those symptoms, you really need to get that checked out. How is toxic syndrome diagnosed? Because toxic shock syndrome gets worse so quickly, it usually is diagnosed and treated based on symptoms. Without waiting for a lab test result, tests can help show whether staph or strep bacteria or cause the infection. Tests you may need include as blood tests on body fluids or tissue, chest x-rays, tests to rule out other infections. How is it usually treated? Well, usually takes probably place in hospitals. Maybe some really nice doctors have it. Remove the source of the infection or clean out the wound. Treat components such as shock or organ failure. Give you antibiotics, which is usually medicine. How can you prevent it? Well, you can take steps to prevent TSS. Avoid using tampons or barrier concepts such as diaphragms, cervix caps, or sponges during the first 12 weeks after childbirth. Okay, so if you're pregnant and you just had a baby, you're probably a woman, you probably already know this stuff, but just in case, if you do, after 12 weeks, and you use it, just use a pad. Be comfortable. Don't use a tampon. Follow directions on package to insert the tampon. Change your tampon at least every 8 hours, which you're supposed to use it 4 to 8 hours. Maybe if it's a really heavy flow, maybe less. Use a tampon for only part of the day. Do not leave your diaphragm or cervix sponge in for more than 12 to 18 hours. So don't always use a tampon. Maybe use a pad once in a while. Maybe when you go to bed. Tampon, day, nighttime, pad. Keep all skin wounds clean to prevent infections. So if you have cuts anywhere, clean them out with peroxide. I don't know if you know that, or Neosporin. Help keep children from scratching chickenpox sores by managing itching. So if your child or you have chickenpox, do not scratch. Okay, and if you had menstrual TSS, do not use tampons, barriers, or any interior device. So if you did have it before, you can get it again. So if you want to still use it, but you've had it before, be careful. And once you get off TSS, if you've had it, just wear pads for a couple of months, because that could prevent it from coming back. Now, if you need more help on your period, or any questions or anything, this is what I did. I go on beinggirl.com, and it has tips about first periods, my body and wellness, my relationships, my life, my beauty and style, ask the experts, entertainment, products, free samples. And I'll show you what the website looks like. See, I'm on my laptop. They also have, if you do get your first period, they also have calendars, which you can put on here. Like if you have it, usually periods last for 3 to 7 days. So if you have it, they have a calendar right here. And you can have an online calendar which will remind you every once in a while when 30 to 28 days come along. I hope you enjoyed this video, and I hope it was helpful. Make sure to tell your doctor to ask or tell a guardian if you have it. Or if you're an adult yourself, go see a doctor. Thank you.